Basically, there was an interesting statistic which I was able to dig up earlier on in the weekend. The latest figures from the Office for National Statistics, that is the government official website, which is where all figures for deaths are recorded. For the week ending 16th of October 2020, the number of deaths registered in England and Wales was 10,534. Now, this was 580 more deaths than in week 41, right? But in week 42, the number of deaths registered was 6.8% above the 5-year average, which meant it was 669 deaths higher than the same time the previous year. Now, here's the interesting bit, though. Of the deaths registered in week 42, 670 mentioned novel coronavirus, COVID-19, accounting for 6.4% of all deaths in England and Wales. So I'm telling you that this is the facts. These are the facts, 6.4%. Now, you might say to me, well, that was on the 16th of October. It might have doubled since then. Well, even if it has doubled since then, it's still going to be around about 10% of the people who are dying of COVID-19. So why are you shutting down practically the entire economy of the country on Thursday? That would be my question. Let's ask Peter Hitchens. Peter, very good morning to you.
Good morning.
Thank you very much indeed for joining us. As ever, you probably saw those figures that I was just quoting from the most recent week that the ONS has collected them. I mean, it seems extraordinary to me that, one, the government's doing what they said they wouldn't do, and they're using data which hasn't happened yet in order to justify it.
Well, it seems, I think people have been trying to get hold of the basis on which the figures which the government were using on Saturday were compiled, and they haven't been able to get hold of them. So much of this stuff is guesswork, dressed up as science, so-called stochastic or modelling, and people think that because it's presented to us in men with white coats or with large qualifications, that it must be true. It's speculative. There's a fascinating piece of information now available, and something which everybody should read. I connected to it a lot at the end of last week. Fraser Nelson, the editor of The Spectator, last week wrote on his blog an extraordinary article on what actually happened during March and April, on the way in which, although we were under the impression that the intensive care beds in hospitals were completely overwhelmed, this simply was not so. And also because we were under the impression that many people were under the impression that the shutdown on March the 23rd had led to the subsequent fall in COVID cases. This also wasn't true. It's now pretty much accepted. I remember arguing about this at the time, that the period between infection and death, if death is the end of the infection, is approximately 4 weeks. It's simply not possible that a lockdown, which began on March the 23rd, could have led to the peaking of COVID deaths in this country on April the 8th. So these incredibly important pieces of information, which tell us what happened last time, seem to me to be very useful in judging what's going on now. The other thing, of course, is what do the figures mean? The most touted figure, which is constantly wheeled out by the BBC, the figure of supposed infections, is actually a figure of positive tests of doubtful accuracy, mainly conducted on people who are perfectly healthy, and doesn't really mean anything because the more tests you have, the more positives you'll get. The second figure of hospital admissions, I've been trying for weeks without success to get from government information services such details as the people who are listed as COVID admissions in hospitals, how many of them came to hospital because they have COVID? And how many of them were actually tested and found to have COVID after they arrived? This simple fact is not obtainable. As to so it's almost impossible to get accurate figures about the real occupation of intensive care beds in real time.
No, that's quite right. Also,
all these things are just constantly touted as if we were on the brink of a disaster whose existence is in some doubt.
Well, indeed, not just in some doubt, but based, as Carl Hennigan said this morning to Julia Hartley-Brewer, on out-of-date modelling. He says that he's looked at the modelling that was announced on Saturday, and he reckons it was done about 3 weeks ago. And he said if it was accurate, we would be dealing with 1,000 deaths a day, and we're not. We're dealing with around 300 deaths a day. So their original plan is already wrong, if you like.
Yes, you also have to bear in mind the following absolute facts. Every year in the National Health Service, beginning round about the start of September and going on particularly into December when it often becomes very serious, we have large numbers of people going into hospital with respiratory illnesses. This always happens. there is currently a strong pressure on medical staff, not so much a pressure, and an obligation, because it's become a notifiable disease, to record COVID where it's present in people who are in hospital for this purpose. But that doesn't necessarily mean that it's the main thing they're suffering from. So again, we're back to the old dispute about whether people are in hospital with or for COVID.
Yeah.
And also there is, as people will have been noticing, a curious feature in current statistics, which is that the numbers of people in hospital for pneumonia and influenza seem to have dropped to below normal levels while the COVID figures are surging. Could this be simply a matter, again, of classification rather than of the disease itself being the main reason for these things happening? I don't know, but I don't think the figures that we have or the information that we have can tell us for sure. And as I say, the government is completely determined, it seems to me, to follow these policies of radical close down of the economy, and therefore it grasps at whatever figures seems to suggest that this is justified policy. That doesn't necessarily mean that it's correct, and I think there should be much more skepticism about it than there is.
No, I think you're absolutely right, and I think the fact that you and I and others are asking questions about it is entirely legitimate, and I find it bizarre that some people think that by asking questions you're somehow rabidly mad and crazy because you don't believe in COVID-19. I've never said that, and I don't think you have either. We both accept that it's a dangerous virus, but equally, I believe that we need to question the way that it's being dealt with.
Yeah, can I tell you a couple of experiences I've had over the past couple of days? On Sunday, I said that the BBC and the government had created the panicdemic, which otherwise no one would have noticed by the constant horror statistics which they produce. And I was accused by huge numbers of people on social media of claiming that COVID didn't exist, which I had not said. And today I produced a large number of charts, actually from the Daily Mail, which has been doing a fantastic job in recent weeks of giving good factual presentation of what's actually going on, one of which referred to the state of affairs in September. I was immediately accused by the same sort of people of trying to mislead because I'd only shown the figures up to September. They're clearly marked September. There could be no intention to mislead if you show clearly what it is. I find that in almost all my discussions with supporters of the shutdown, that they assume that I'm stupid and malevolent. Well, I try to assume, for the purposes of argument, that they're intelligent and have as good intentions as I do. And this is the really bad thing about this. The totalitarian nature of this, a lot of the rage directed against people who oppose this from the start has not been, oh, we disagree with you, but you should shut up. You should be silent if possible. We hate you. You're not just wrong, you're bad. And I get really tired of this. And I'm really pleased that this seems now to have arrived at a point where there is actually something resembling an opposition in this country. The Lockdown Zealots website, the growing number of members of parliament who aren't prepared to take it sitting down, the growing portions of the media who are actually treating this critically. And I think that has really changed now. But I do think the people on the other side really do owe, if they wish to live in a free democracy, they really do owe it to their opponents to treat them with a bit more respect than they do.
Yes, and I'm pleased also to see that the NHS is now being put under the microscope in a way which it has never previously been, because this kind of ridiculous notion that somehow we must save the NHS rather than the other way around is incredible to me. You know, the NHS that we are told is the greatest health service in the world somehow can't cope with winter flu. And every year there's a crisis of one kind or another. And every year we're told, you know, we've only got 24 hours to save the NHS. Every single year.
In many years there are crises. And in fact, this is largely because the National Health Service is actually quite an efficiently run organisation. And in recent years...
In parts.
Well, no, I mean, there are lots of bits of it. We all know of bad experiences that people have had and that we've had with it, but a lot of it is quite well run by hardworking and dedicated people. But one of the things that it decided to do some years ago, and I'm not sure that I agree with this decision, but it's a fact, is to reduce the number of beds greatly and run on quite tight margins, which means that every winter it's almost inevitable that the numbers of intensive care beds will run short. Because there aren't that many of them in the first place. Mind you, intensive care beds can be expanded at quite short notice if you've got the staff to do it. And if you examine the influenza outbreaks of the past several years, you'll find many comparable ones to this, which simply weren't publicised. I think even Piers Morgan's Daily Mirror used to shout quite a lot some years ago about heavy pressure on intensive care beds in hospitals, but it wasn't ever seen as a pretext, let alone a reason, for closing down the economy, which pays for the NHS in the first place, for goodness sake.
Well, exactly right. I mean, the whole point of hospitals is that they treat sick people. You know, the way that this government's operating, you'd think that, you know, they'd rather you didn't get sick, because that's a bit of an inconvenience, to be honest, you know, which seems to be the wrong way around. The other interesting thing that Carl Hennigan said this morning on the breakfast show was that hospital admission figures are about people being admitted to hospital, not necessarily being given a hospital bed. And he said that it's quite often a very big difference between those two numbers. And also, what we don't see are the numbers for the people who are discharged from hospital.
That is very true, and the discharge figures seem to have disappeared from sight. I think they're dropping. So I was making some inquiries about this at the weekend. I think that they are dropping a bit, but they have been quite high, and so the balanced against the admission figures, they have a different impact. But it is very interesting that admissions don't mean people actually taking up beds. And I hadn't realised that, and I think once you hear that, it does make you look very differently at figures at all.
Yeah,
my experience has been, as soon as any statistic becomes important in political debate, it begins to be fiddled. I've seen this in crime figures. One sees it all the time in examinations and education figures, unemployment figures, and inflation figures. When those things are troubling governments, people start. You remember possibly years ago when we used to have a thing called the retail price index, which measured inflation. And it kept coming in with rather high results. So the government produced something called the consumer price index, which left out various things and made inflation look lower.
Yeah.
Inflation, of course, remained the same size as it had been before, but the figures were different. It happens all the time. It's not a criminal offence, and I think one can expect it to happen. And I think the government's commitment to its policy of shutdown is in fact quite possibly causing it to reach for certain forms of statistics. The other thing is there are different statistics on various matters. So the statistics on deaths and on hospital admissions and all kinds of things have more than one source.
Well, that's the thing. There are many different figures, and you can take your pick. I think the last piece I read about this last week when I was off, there were 3 different studies, 3 different models, all of which gave different numbers and different outcomes. You know, all of which said that the numbers were going up, which we have seen and which we can expect. But I was thinking more broadly, Peter, about this, that we have come to this point in government because of what has gone before, in that the governments of recent times, probably the last decade or so, have relied on data as if it's sort of the holy grail, right? They've gone out collecting data. Some of it can only be from polling. Some of it can just be from asking questions to people and asking them what they want and making policy on the hoof based upon what they think they can prove will work because they've got the data. It's like they've become obsessed with numbers.
Well, I'm all in favour of data if people look for it in a properly impartial and balanced fashion. What worries me is the way in which people hunt down data which suits what they've decided to do anyway. And here is the other thing, which I think we ought to be worrying about here, is Parliament on Wednesday is faced with this choice of yet again following the policy of shutdown. And there is still no proof that these shutdowns work. In fact, at the utmost, on their own terms, all they can do is postpone and delay the spread of disease. They can't actually halt it. The idea that we can suppress a disease is a fantasy. And in the name of this, MPs are about to vote for a measure which will undoubtedly destroy the small businesses and the jobs of large numbers of people. And I'm calling for people to write to their members of parliament and say, look, when this really kicks in, when it begins to be felt, which I suspect will be around about February, March of next year, there will be no such thing as a safe seat. And write to your MP politely, briefly, acidly, saying, if you're going to vote on Wednesday night for the destruction of other people's jobs, why on earth do you think that your job should be saved? I don't think there's anybody reasoning with these boobies. Most of them can't reason, but they can certainly count. And if they understand that once this all begins to feed into real unemployment, there will be no such thing in this country as a safe seat, I think it might conceivably concentrate their minds into putting up some sort of opposition to this. When people talk about safe seats, I say, look at Scotland. before I think, what was it, 2015, there were dozens of totally safe Labour seats.
Yeah.
Where are they now? They've all gone completely. So this assumption people make that MPs are untouchable and that some MPs make is wrong. I beg people now, write to your MP, email your MP. It's fantastically easy. Be brief. Don't try to persuade them. Just try to make it clear that if your job is at risk, theirs should be.
Well, indeed. In fact, Andrew Bridgen was on earlier, and I said to him, I put it to him, which one of our listeners had suggested, that would you be willing to promote a bill in the Houses of Parliament which would make all public sector workers take a 20% pay cut, aside from emergency workers, because the police and the fire department and the nurses and the NHS workers, they're all exempt from it. But every other civil servant, every other public sector worker takes a 20% pay cut in order to feel the same pain that people in the private sector are going to feel if they're put on furlough.
But yes, but 20% is not enough for people in that class. If someone's on a very, very small wage and working all the hours God sends, a 20% pay cut is a really huge hole in their income. A comfortable middle class professional person, a minister or a member of parliament, they can cope with a 20% pay cut without any great difficulty. It would really, if you were going to do it seriously, have to be much, much bigger than that. They're not going to vote for it, I'm afraid.
No, of course they're not. I mean, he did say he would support it, but so I'm going to keep banging that particular drum because I think the point is that people have done the things that they've been asked to do. By and large, most people, like yourself, albeit reluctantly perhaps at times, have adhered to what we've been asked to do. And suddenly now they're blaming another group of people for why the lockdown has to happen. He was blaming young people, people who refuse to adhere to the social distancing measures. All of that to me is nonsense. It's got nothing to do with the fact that certain people are not adhering to the rules. It's everything to do with the fact that the rules are not making any difference.
Well, quite. And where is the evidence for this anyway? I see none. It's just all part of the tiny little circle. They're all like hamsters in a wheel, these people. They believe one thing and everything they see confirms it. So if the shutdown doesn't work, it's because people haven't obeyed it sufficiently. Yeah. If the shutdown is followed by a reduction in disease, then it must have been the shutdown that caused it. No other argument can enter into their tiny minds. As I say, I've spent the past several months treating my opponents of this as if they were intelligent. I'm beginning to think the moment has come to actually treat them as stupid, because it is outrageous the way that they visit this damage. If they were just talking like this, who'd care if they sat in the pub saying these stupid things? But the consequence of this stupidity is that huge numbers of people, imagine if you've spent 20 years building up a business, you've mortgaged your house for it. You've worked enormously long hours, not taken holidays, and now, through no fault of your own, the government is turning around and destroying your business. Someone came into your small shop or cafe with a sledgehammer and smashed it up, and they were the government. What kind of country is it where the government destroys enterprise and destroys jobs? People all get elected on the promise, we're going to create millions of jobs, we're going to create a prosperous economy. Here they are, smashing up an economy already in trouble and wrecking businesses and destroying jobs, and they are dangerous.
I mean, I just spoke to a 96-year-old veteran who, for the first time since the Second World War ended, is unable to come to the Field of Remembrance in Westminster this Thursday because the government have told him it's too dangerous. This is a guy who then explained to me how he was blown over a hedge while he was driving a Jeep in northern France during the World War because a bomb went off underneath his Jeep, and he was laughing about it. And he's being told that he shouldn't be allowed to come to London because it's too frightening.
I know. It is pitiable, isn't it, that we're reduced to this stage. Let us choose whether we're frightened of this virus.
Yes, I think that would be a sensible thing. But, I mean, do you also have any hope that come December the 2nd, which is now the date by which Rishi Sunak says we will come out of this into some tiered system? The tiered system clearly didn't work. Otherwise, we wouldn't be doing this, would we?
Well, you would think so, wouldn't you? I don't have, after all, Michael Gove went on the television yesterday and pretty much confirmed what most of us had thought, which is that December the 2nd is a fanciful thing. And we, once again, in the Hotel California, which you can never leave, we've been moved out of the slightly more spacious suite into which we were moved into a more cramped and miserable one. And that's all that will happen. But I will be surprised if on December the 2nd anything more happens than there'll be a tiny concession. Perhaps they'll I don't know, allow the churches to open at Christmas and permit the rule of 6 to be varied so that children aren't counted, or some such token concession So the government doles out normal life to us in ladlefuls. Normal life, which has denied us for months, is now in their possession. What sort of country is it where the government decides whether you can live normally?
Yeah. But also, I've spoken to people who run businesses who don't know whether they can order Christmas, sort of stock or not, because they don't know whether it's going to be able to be sold.
No, and this is a particular catastrophe. This is usually the golden quarter for people running shops, and indeed a lot of hospitality business as well. This is the time when they make, which makes the difference between profit and loss, and the government has chosen this time to savage their opportunities of making their books balance, let alone making any money. It's unbelievable. These people, they are not. I've called them incompetent because it's quick. But the fact is, what they realize, people lacking competence. I mean, if you or I were ushered into the cockpit of a Boeing passenger jet and shown the controls, we'd look blankly at them. I wouldn't know which one to press. I don't have the competence to do it. And these people, with their degrees in philosophy, politics, and economics, and their years and years and years of backstairs crawling in political parties, which is all the skill they have no idea how to understand the data that's put before them, and apparently no understanding at all of how economies work.
No, I quite liked your allegory about them in a train, running a train, sort of headlong down into a sort of downhill spiral.
It came out of an old poem from which Lord Beaverbrook used to be very fond of, called "Who's in Charge of the Clattering Train?" And there they are, these two children who've climbed into the cab of an old-fashioned steam locomotive and fiddled with the levers, and suddenly find that it's moving, and they can't stop. The whistle is shrieking, the safety valves are blocked, the train is gathering in pace and is bucketing along behind. All the passengers in the carriages are wondering what on earth is going on, and unable to stop it. They can't even get these people to hear them, and if they could, they wouldn't know what to do. I'm afraid the last line of the poem, "Who's in charge of the clattering train?" is death is in charge of the clattering train. Because the poem was about a real event where a train ran out of control and crashed into another one. These people are completely unfit for the job that they're doing, and they're driving us to disaster. Partly, I think, again, because they know they've made a mistake, but they can't stop.
No. Well, that's a terrible way to end, but we have to end, unfortunately. Peter, thank you very much indeed. Peter Hitchens, Mail on Sunday columnist. Who is in charge of the clattering train? And can anybody stop it? This is Talk Radio.